Hello, I'm Dr. Eric Potter. Today I'm going to give you a little workshop on healthcare insurance at Sanctuary. The subtitle is How to Hold a Hammer the Right Way. Many of my patients will come and ask, why are you so against health insurance? Why don't you take insurance? Well, I'm not against healthcare insurance. What I'm against is grabbing a hammer or healthcare insurance the wrong way and trying to drive a nail in. It doesn't get the nail in and it can potentially hurt someone. Healthcare insurance is like that. If you try to grab it the way the healthcare insurance industry wants you to, it ends up with having short visits, 10 to 15 minutes with your provider, expensive tests that may or may not get anywhere. What I want to be is pro-patient, pro-using this hammer of healthcare insurance to bring about good results, restoring their health. The way I do that is by staying out of network. Out of network means that I'm not contracted with the insurance company to get paid from them for care that I provide to you. It means that I ask you to pay me directly. You want to submit those bills later, you are free to do so, but I'm not dependent on following the rules to be penalized or incentivized to do things that I don't think are the best clinically for you. Then we have the freedom to work together, my hand and your hand, to swing the hammer in the right way. So what is the right way to use healthcare insurance? I've talked about there being a wrong way. What's the right way? Number one is being informed. You need to know what your insurance provides, what it offers, what it covers. You need to be informed about the choices. Sometimes insurance is not going to inform you of all the medical choices that are out there as regards to tests or therapies. You need to have those choices before you so you can decide. And then if some of those choices are ones which are not covered by insurance, we at Sanctuary can often offer those things at wholesale prices. If there's something that can come through us, you get the best prices possible, even if you are paying out of pocket for them. Then you can make wise choices that are going to bring faster results, where we spend more time, more options to restore your health. In contrast, the wrong way to hold the healthcare insurance hammer is the way that's being done in most of the world right now. Using 10-15 minute visits, only being limited to options that the healthcare industry, the healthcare company says they're going to cover. We want to get away from that, and we do that by being out of network. Now, that requires a little extra work, both on our part and your part. On our part, it means that we've taken a lot of time to research which labs are going to be the best, whether a urine or a blood or a saliva or a stool test may be better in a given situation. We've taken a lot of time to research the prices, picking a company that's going to provide this test that's just as good as this one, but at a cheaper price. We're going to help you know which one you should go with, or if it's a matter of which insurance company is going to cover this lab versus this one. With that, we have to take the time to explain, so we can't do that in 2 or 3 minutes. These are complicated decisions that require us sitting down and spending some time talking together, helping you know what are the options and what we believe clinically is going to get you better faster, what's going to restore health. Now, also in the background, my staff is going to spend a lot of time filling out forms. Even though we do not submit directly to insurance ourselves, we do provide information to lab companies so that they can send the bills in to your insurance company. So we will ask for your insurance card and things like that. We'll fill out a lot of forms. We're going to take that time to help you provide the right codes. For example, the diagnosis codes, something called an ICD-10. We are going to try to give our best code diagnosis of what your symptoms are, what we think your disease process is. But to give you an example of how difficult it can be with insurance companies is the fact that there was an instance where I put the right code on a patient's lab, but it took about a week, maybe 3 or 4 times going back and forth for the insurance company to finally explain, well, the right codes are there, it's just you put it number 2. If you switch that around, we'll pay for it, and the patient will get reimbursed. But if you don't, we won't. It was very simple, but it took probably an hour, 2 hours of our time to sort that out. Now, what's your role in this? Well, you do have to prepare a little bit. Preparing by looking at your insurance policy, knowing your finances, what you have to work with as far as how much you can spend on testing, talking to your insurance company before that first visit. We do recommend that you give them a call if you're planning to submit anything to insurance and ask them these specific questions. Tell them you're going to see an out-of-network provider. how and will they cover the expenses from those visits? Will they cover and how much, whether it's a deductible or copay, for labs that we at Sanctuary might order, or therapies, prescriptions, x-rays, CAT scans, things like that. Having that information before the visit means when we're sitting down at the end of that initial visit talking about tests, you have an idea how much you need to spend to try to restore your health. You also may have a little bit of paperwork to fill out. That's another part of your participation, is in that participating in that discussion. We may give you an invoice if you're wanting to submit our invoice for a visit. Sometimes patients do that and they do get part of the visit reimbursed. You'll be responsible for that part. All that together, we also need your insurance card. Even though we don't submit it to insurance, we will provide that information to the lab company so they can submit that. What does this all produce? It produces labs that often get covered, or the ones that don't, you get the best prices for them. X-rays, CT scans, echocardiograms, things like that are often covered. Many therapies, particularly prescriptions, even with prescriptions, if you find out, oh, it's going to cost me more to buy it at Walgreens or CVS or whatever pharmacy you may use, we sometimes can offer some prescriptions at discounted prices, the wholesale prices again. Now, we can't guarantee that any of these things will be covered, the labs, the therapies, our visits, but we will do our best to help you as long as you do your part that we've talked about in those responsibilities. We want to be an advocate for your health and restoring your health. That means we ask you grab the hammer, we grab the hammer, and together we swing at that nail to try to nail down what's causing you harm, what's causing your health to feel as it is, and restore your health in as quick as possible time. Now, if you have any other questions, please give Stephen a call or send him an email to ask about how your insurance may work with Sanctuary Functional Medicine. And again, we look forward to meeting you in person or in video at your upcoming visit. Have a good day.